Twice a month here on Channel 6, we get a chance to talk with one of the fine folks that serves us in this community from Saddleback Memorial Medical Center. And joining us today, Dr. Powell is with us today. Dr. Ledford Powell, welcome to the show.
Thank you for having me.
You are a thoracic surgeon?
Yes.
And we talked about the fact earlier that that has given people great pause in the past thinking what you're going to do, but you were saying a lot of the things you do today are done with microsurgery and even with video cameras.
Yes. Actually, we've moved more towards offering a more minimally invasive approach to surgery on patients, and it actually allows patients that could never have tolerated these types of operations before, particularly our elderly patients, to be able to tolerate these procedures. Yeah. What we've seen is patients have faster recovery, less time in the hospital, and usually get back to their normal lifestyle much faster than previous.
And probably more inclined to say yes to the procedure if it's not as invasive perhaps as well, if that's a decision they have to make, of course.
Yes, absolutely.
So cancer is something we all hear about, and we've all either been touched with it personally or family members or friends. Everybody knows somebody who's been fighting it or has fought it in the past. November is Cancer Awareness Month, and this is the time when all doctors are telling their patients some things they should think about as far as cancer, but specifically in your case, lung cancer.
Yes. So, yes, you're right. This is Cancer Awareness Month, and obviously this is something very personal and dear to me. Spent many years studying and working in this particular field, and what we have come to learn just in the past year or two has been pretty impressive. Previously, most lung cancers were advanced in stage at the time that they were diagnosed. Actually, about 80 to 85% of patients were never considered curable or surgical candidates. Now we have screening programs that allow us to diagnose patients before they're symptomatic, because we know once they get symptoms, chances are the stage is far advanced. And by screening patients, we actually have shifted those numbers where we're starting to see 80% of patients diagnosed in the screened population with early stage disease and 20% with a more advanced stage. So obviously this is going to shift the frame a little bit, and we're going to hopefully start seeing a lot more patients with early stage disease that we can offer a cure to.
And obviously survival rates go up when you catch it earlier, so that's important as well. Yeah,
significantly.
As well as the procedures involved can be, shall we say, less advanced, less invasive, and less damaging otherwise to the person if you can catch it early.
Well, yes, exactly. So you're doing a lesser of an operation, and with a new and minimally invasive approach, patients actually can go ahead and have this procedure done, and many of them are out of the hospital in about 2 to 3 days.
Yeah. We hear so much about smoking, and I know organizations like the American Cancer Society have the Great American Smoke Out and other promotional events to try and encourage people not to smoke. Not being a smoker myself, I'm told that it's extremely addictive and it's extremely hard to quit. But for those that can quit, I understand that the lung is a wonderful device and it starts to regenerate almost the next day if you stop smoking.
Well, what we do know is that the longer you smoke, the more damage you've caused to your lungs. And the patients that are at highest risk from what we know are patients that have smoked at least 30 pack years, meaning you've smoked a pack a day for 30 years. The longer you are away from that tobacco exposure, the closer your lungs return back to normal, and your risk of cancer starts to drop closer to the general population.
Right. You know, we've all heard the stories of the celebrities that have had lung cancer, John Wayne, I guess, being a prime one that lived here locally in nearby Newport Beach. But there's also lung cancer can hit somebody that's not a smoker as well, I understand. What's the risk factor there?
Yeah, that's a topic of much debated research. We do know that 90% of patients with lung cancer have some tobacco exposure. So there's 10% of patients where we cannot come up with that type of history. There's environmental exposures, there's air pollutants, there's argon, radon, heavy metals, a host of different things. But for the patients that don't have those main risk factors that are still getting cancer, that's something that we still need to do a lot of research in.
You mentioned that you're catching it sooner. What are some of the things people should do or think about doing testing-wise or otherwise with their doctor to catch this earlier?
Well, I think each person needs to look and see what their risk factors are. So if you have a smoking history, significant smoking history, if you're over the age of 50, you should talk to your doctor about getting a screening CT scan done. Most of the screening CT scans are not paid for by insurance, and so the screening programs will allow you to pay out of pocket for a nominal fee of about $125.
Yeah.
So most people can afford that. So if you have a candid discussion with your physician and you think that you're at reasonable risk, then I'd say go ahead and get a screening CT.
You said a lot of times people don't realize it until it's far advanced. Would there be a significant signal in the body, shortness of breath, coughing excessively? How would someone think they might need to get that test?
Yeah, the symptoms that you've described are very common symptoms that we associate with advanced lung cancer. Unfortunately, they're also the same symptoms you would get from the flu or pneumonia or a bad day at work. And so many of those symptoms go ignored. And that's the problem. So it's really, what are your risk factors? If you have the risk factors, sit down with your doctor, consider the screening CT.
Are there other factors involved, men versus women, or racial factors?
There are, and that's a very complicated discussion, but we do know most of the studies have been done in white males. Men are more likely to be diagnosed with lung cancer than women, but we still see in women lung cancer-related death. Lung cancer still is #1 in women and men. And so it still affects both genders pretty significantly.
Talk about Saddleback, some of the screening programs and treatment programs available right here in our community at Saddleback Memorial Medical Center.
Yes, so we're pretty excited. Saddleback has a lung cancer study group. They also have a weekly tumor board. Many of the thoracic surgeons, oncologists, radiation oncologists, and internists sit on that board, as well as our pulmonologist. And this week we'll be having a health fair targeting screening for lung cancer. And at any time, someone can contact the facility and ask for a screening study to be done and pay the $125.
Right, very good. Again, talk to your doctor about that if you think you might have some of those risk factors. You want to make sure, and especially if you've smoked, as you say, 30 years or more, would definitely be, I think, important. $125 to spend there. You also have ongoing seminars and groups as well to help people who are going through the process.
Yes.
Both surgical and chemotherapy and otherwise. So a lot of ways to help folks in this area.
Yes.
Dr. Powell, thanks for joining us. Good to have you on the program today.
Thank you for having me.
Saddleback Memorial Medical Center, again, serving this community for a good number of years. And if you have questions or want to find out more, need a doctor, there's a number on the screen, 1-800-MEMORIAL. You can find out more about the programs over there, as well as perhaps find a doctor if you don't have one currently in the local area. We'll be coming right back with more as we continue after this.
Now I found an ocean blue in my house, my living room. Ride the waves in my canoe, and you know that it saved me.
We can keep you healthy and care for you when you're not, right in your own backyard. Memorial Care Heart and Vascular Institute at Saddleback Memorial, because a lot is resting on your heart.